Incidence and mortality risks of gastrointestinal cancers during working age period. Trends and disparities in 204 countries and territories, 1990 to 2021. This is the first global study focusing on gastrointestinal cancer risks during working age. The left side outlines the core innovations. The figure on the right is the visual abstract. This study fills a critical gap by quantifying GI cancer risk during working age years using the AMP method on GBD 2021 data, providing 32-year trends analysis across the globe. Next is the methods section. We utilize the GBD 2021 database, covering 204 countries from 1990 to 2021, focusing on incidence and mortality risks of 6 GI cancers during working age. Geographic regions were categorized into 21 GBD regions, and countries were divided into 5 quintiles based on SDI scores. We applied the adjusted for multiple primaries method to calculate working age risks, which accounts for competing mortality risks and corrects for multiple primary cancers. For trend analysis, we used joinpoint regression to compute the annual percentage change and average annual percentage change. We also conducted attributable risk analysis and sensitivity analysis, comparing our estimates with traditional cumulative risks. In 2021, the global working age risks of developing and dying from GI cancers were 2.19% and 1.37%, respectively. Colorectal cancer had the highest incidence risk, followed by stomach and liver cancer. For mortality risk, stomach cancer was the most lethal, followed by colorectal and liver cancer. The incidence and mortality risks in males are nearly twice as high as those in females. In 2021, both GI cancer incidence and mortality risks were highest in high-middle SDI countries and significantly lower in low and low-middle SDI regions. In 2021, East Asia had the highest incidence and mortality risks. During 1990 to 2021, while most regions showed declining incidence risks, the Caribbean and Southeast Asia demonstrated significant upward trends. Notably, mortality risk decreased consistently across all 21 regions. Between 1990 and 2021, overall working age incidence and mortality risks showed continuous downward trends. By cancer type, for colorectal cancer, incidence risk increased across all SDI levels except low SDI regions, while mortality risk decreased in all regions except low-middle SDI. For stomach cancer and esophageal cancer, both incidence risk and mortality risk declined across all SDI levels. For liver cancer, despite periodic fluctuations, global risks trended downward, except in low-middle SDI regions where both increased. For pancreatic cancer, global incidence risk remained stable, while mortality risk declined in high and high-middle SDI regions but increased elsewhere. For gallbladder and biliary tract cancer, global risks decreased, but increased in low and low-middle SDI regions. At the national level, Mongolia had the highest incidence and mortality risks in 2021. Most countries experienced declining trends between 1990 and 2021. Colorectal cancer was the leading GI cancer type, exhibiting the highest working age incidence and mortality risks in 134 and 102 countries, respectively. The significantly low risk of developing GI cancers from ages 15 to 40 meant the cumulative incidence risk from ages 15 to 64 remained comparable to that observed between ages 40 and 64. A similar pattern was seen in mortality risk, with minimal risk before age 40 and comparable cumulative mortality risk between the entire working age span and later working years. In summary, the 2021 global working age incidence and mortality risks of GI cancers were 2.19% and 1.37%, respectively. Colorectal cancer exhibited the highest incidence risk, while stomach cancer had the highest mortality risk. Males demonstrated approximately twofold higher risks than females. High-middle SDI countries exhibited the highest risks, with East Asia and Mongolia leading at regional and national levels. Ages 40 to 64 represent the high-risk period during working years. Despite an encouraging decline in overall GI cancer risks, the persistent increase in colorectal cancer incidence risk emerged as a concerning pattern.